I think there's two areas. One is private health insurance for working Americans. We've got work to do there.
Yes.
And I think the key is health savings accounts, portability, and consumer-directed health care, free market principles. With regard to Medicare, though, it's important that people understand that if we don't come to terms with the debt crisis that we're facing in this country, Medicare and Social Security are going to face mandatory budget cuts in the next 10 years. Mandatory. That are going to impact people that actually rely on those benefits. I can't tell you how old my wife is, but she just might be eligible. She is now a grandmother of 3, and so I'm a grandfather of 3. But look, it's one of the reasons why I talk about the national debt. It's one of the reasons I talk about the need to find a way to reform Social Security and Medicare for younger Americans and make sure that it's solvent and strong for people our age, and frankly, anybody over the age of 40. I just think you keep the same deal, Social Security and Medicare. Don't make any changes. I don't really believe in changing horses in the middle of the stream. You've been working for 20 years. I'm not going to change the program on you. But for people under the age of 40, I think the time has come for us to have a conversation about how we can reform these programs, keep them there solvent for us and our generation and the one that follows, but for younger Americans to really lift a massive burden of debt off of them by reforming these programs, and that's a big part of the equation going forward. So I think we can improve Medicare. I think we can stave off those mandatory cuts in 10 years, but it's going to take leadership, and it's going to take bringing people together in Washington to figure out how to get it done.
That's a big one.
Quick follow-up on the national debt. You served in the Trump administration as a vice president, and although the national debt and federal spending looked different then than it does under the Biden administration, that national debt did grow while you were in the White House. What would you do differently, and how do the American people know that that national debt won't continue to grow if you were president?
Well, let me say what we wouldn't do differently. Number one is Barack Obama had gone through years of budget cuts in our military. We had a lot of catching up to do. We had the largest increase in our military spending since the Reagan administration, and I thought that was money well spent. The other was during the pandemic. I think one of the reasons you have government is when history shows up, and you've got to have the wherewithal to be able to be there for businesses, for families, to see the country through the worst pandemic in 100 years. In between all that, Amanda, I'll stipulate to your point, we didn't do as good a job as we should have done controlling domestic spending. And that was with Republicans in control in Congress for part of it, Democrats in control. But people that know me well know that I'm a cheerful but tight-fisted conservative. And we will put our nation back on a path toward a balanced federal budget. But the biggest piece of that is going to be you got to have leadership that knows the Congress and knows how to create an environment where you can have a conversation about reforming what is most of the federal budget today, which is Social Security, Medicare, and interest on the national debt. That's about 75% of the federal budget, and it's growing. And so, for me, I think we could have done a better job. We'll make fiscal integrity a priority of any administration that I lead, but I really do believe that for our national security, for our nation's economy, for future generations like yours, we've got to come to terms with that national debt and give our kids a better deal and a better future with reform.